Hello, my name is Amanda BakkeA, and today I'm presenting the project Exploring AI Scribes in Rural and Remote Healthcare, Facilitators, Barriers, and Training Needs. For disclosures, I am a research assistant with the Dr. Jal Arkan Center for Health Equity at Nawsum University. This project was funded by NOAMA and the Wawa Local Education Group. AI is increasingly being introduced in healthcare, and AI scribes have shown promise in alleviating administrative burden of physicians. However, there are concerns when integrating AI into practice, including technical issues, ethical considerations, privacy concerns, and funding and infrastructure limitations. These concerns are exacerbated in northern rural and remote communities that often face challenges with technological implementation due to gaps in broadband access. Our study objectives were to investigate the opportunities and barriers to implementing AI scribes for primary care providers in Northern Ontario, as well to assess educational and training needs for AI scribe adoption in rural and remote healthcare communities. We used a mixed method study, including an online survey and focus group with quantitative analysis used to synthesize survey demographics and thematic analysis of survey and focus group responses to generate benefits and barriers of AI scribe use. And this data was all backed by quotes pulled from the participants of the survey as well as the focus group. There were three main benefits of AI scribe use identified by participants. 76% of participants said reduced administrative burden is the main benefit of AI scribe use. 51% of participants indicated AI scribes reduce cognitive load by reducing burnout and improving work-life balance. 35% of participants reported an overall improvement in the quality of patient care they were able to deliver in their practice. There were four main barriers to AI scribe use identified by participants. Funding limitations was the most reported barrier, with 48% of participants agreeing this is an obstacle to implementation. 48% of participants also reported technical performance and logistic barriers of AI scribes during implementation. 37% of participants said AI scribes could impact workflow and lead to the erosion of clinical skills. Lastly, 34% of participants acknowledged that AI scribe use could lead to threatened patient safety and legal considerations. The participants also identified AI training needs, with 63% indicating a desire to learn about the use of AI scribes and 57% interested in learning about foundational AI literacy. However, 60% of participants noted that the time requirement for training and integration is a major barrier for uptake. Some future directions of this project would be to explore AI technology adoption in under-resourced settings, to assess the long-term impacts of AI on northern, rural, and remote healthcare, as well as gather patient perspectives on AI implementation, including their concerns related to trust, communication, and care quality. And lastly, explore the use of AI in medical education. In conclusion, this study highlights the potential of AI scribes to improve primary healthcare, while demanding targeted funding and implementation in northern, rural, and remote communities. For those with experience with AI scribes, please feel free to comment about the pros and cons you have encountered with its implementation. And for those with no experience, feel free to comment what you would need to implement this technology into your practice. I would like to acknowledge our research partners and thank everyone for listening to my presentation. If there are any questions or comments, they can be directed to myself via my email. Thank you very much.